Joining us is Berger, professor and endowed chair of the College of Nursing at the University of Nebraska Medical Center. Thanks for being with us.
You bet. Glad to be here.
Okay, so how important is fatigue in all of this?
Well, fatigue is the most frequent and the most persistent symptom that is reported by cancer patients, both before and after, as well as during treatment.
Okay, so in terms of screening and assessing for cancer-related fatigue in clinical settings, can you provide an update?
Well, we would like to have clinicians think about fatigue in a similar fashion to the way they think about pain. We talk about pain being the fifth vital sign, and fatigue, we would like to make the impression that that could be the sixth vital sign. And a screener for fatigue could be on the intake interview for every patient at every clinical visit in an oncology setting. And when they are asked to screen for fatigue, we generally use the scale that's been recommended by the National Comprehensive Cancer Network, where you ask the person on a scale of 0 to 10, how would you rate your fatigue today? 0 being no fatigue and 10 being the highest fatigue you can imagine. And that when someone gives a score of 4 or more, then further assessment would be done so that we could try to unveil or see what the possible mechanisms or etiologies are for that fatigue and begin to give them some more specific ideas about how they might manage that fatigue.
What do you see as the relationship between those two symptoms you mentioned, pain and fatigue?
Well, I think the connection there is that they are frequently reported symptoms. We do know that most people that have unrelieved pain will probably report fatigue, and so that's a very important link that pain needs to be managed in order to try to modify fatigue. The reversal is not necessarily true, though, that people that have fatigue always have pain. But one of the real trends is, instead of thinking of pain as one symptom and fatigue as another and maybe nausea and vomiting as a third, that you develop a pattern of when the pain score is a 4 or higher, then you immediately go on and ask about the other related symptoms so that you see a better picture of what might be going on in each individual.
If identified, what interventions might the clinician teach the patient and the family?
Well, we're in a very unique position right now with cancer-related fatigue, and that is that in 2009 and early 2010, we've had published very large, what are known as meta-analysis, or summaries where they've looked at all the research that has been done so far, and we know there's 2 major interventions that, of course, each individual would have to be evaluated to make sure that they were able to participate. But the first one is physical activity or exercise. We know that when patients maintain or try to improve their physical activity levels after the diagnosis of cancer, whether it's initially when they're starting treatment or as survivors, or even as they have metastatic disease, that maintaining that physical activity has been shown in a large group of studies with thousands of patients to lower fatigue. And the second one falls under a very major classification called cognitive behavioral therapy, behavior therapies. So these are a variety of ways that the individual learns to manage their behaviors, such as their physical activity, but also perhaps their emotions, and has a way that they've designated that they're going to work out their emotions in regard to what's going on with their cancer, or perhaps their sleep problems that they're experiencing. Then we also know that we have other things called expressive therapies, where someone keeps a journal or goes to a support group or participates in some way of expressing all their emotions, that also has been shown to relieve cancer-related fatigue.
Where is the practice and research going in the area of fatigue?
Well, thank you for asking that. One of the real challenges is that fatigue is a word that is not generally used in the vocabulary of most cancer patients. And we are talking about the way we try to measure fatigue, like when I just talked about how would you rate your fatigue. A lot of people don't know what we're talking about. Are you talking about tiredness or exhaustion? So we want to make improvement in measurements, and then we want to identify if the fatigue seems to be more of a physical nature or an emotional nature, or maybe a cognitive one. There are people who have trouble processing information, that interventions be more designed specifically for at least one, if not more than one of those components of fatigue.
And thanks very much for stopping by.
It's my pleasure.
Appreciate it. Ann Berger, bringing lots of energy to discussing cancer-related fatigue. She is a professor at the University of Nebraska Medical Center.